As we know, some bodybuilders would rather end their career than choose an implant. This was the case, for example, with the Polish bodybuilder Michał Karmowski, who was offered this solution as the only way to save his chest muscles. He refused because he didn't like the idea of this method of bodybuilding, and as this material shows, it was a good decision for aesthetic reasons, because like the use of oil, implants do not always look as one would wish. In today's material, we will take a look at this invention with particular attention to the question of how often bodybuilders use them, and here I will show some of the most spectacular examples I have found. How the history of muscle implants in general looks like, because contrary to common belief, they were not originally made for bodybuilders. They had their beginning in plastic surgery, which aimed to restore people to their best possible appearance after accidents or illnesses. As examples, among others, a damaged biceps after a motorcycle accident is mentioned. As can be read on the Medscape website, an implant can be used in place of the calf for people with a shortened lower leg due to an accident or illness, to minimize the deformity. Although the function of the leg itself is not improved by this, the authors argue that this reconstruction can help to restore a more normal appearance. Some of the more training and bodybuilding related examples include filling a gap in a muscle after a muscle tear, such as the chest. Over time, however, they have also been used to achieve an extraordinary look. Today, the following muscles can be recreated: biceps, triceps, abs, calves, back muscles, where there is space for a total of 4 implants, chest, shoulders, buttocks, and quadriceps thigh muscles. Justin Jedlica, for example, is a real implant phenomenon. On YouTube, you can find a video of his surgery in which new implants were inserted into his back and the teres muscles were relocated. Interestingly, in 2015, he was the first person in the world to have this type of back enhancement. You can also see that he didn't stop at this element because his shoulders also have rather unnatural dimensions. How much does such an operation cost? $21,000. The question in this episode, however, is whether anyone has dared to go on stage after similar operations. And the answer is yes. That's David Sharp, the so-called bodybuilding king of implants. In this photo, you can see an enhanced biceps, triceps, chest, and especially huge calves. Here, the question can be asked as to how this type of silhouette differs from those unskillfully enhanced with synthol or other oils, and visually it is rather difficult to distinguish between the methods. As you can read here, this is a Scottish lad who competed years ago. The last time I saw him compete was in a WABA show in 2003. When he came on stage, the audience went into a stunned silence. Before he got the implants, he competed and looked okay, but I guess his quest for size didn't come quick enough for him. At the same time, his case represents the biggest disadvantage of implants, which is the lack of the ability to truly change the shape of the body. This can be seen very clearly, for example, in the arms, where a normal bicep contracts and, so to speak, changes its shape, while an implant can only bend. In this sense, the best place for such an accessory would be a muscle that you rarely use, or one that changes its shape only slightly. Abdominal muscles seem to be a good choice, until you see this Canadian couple. Both of them decided to get muscle implants, the woman a 6-pack and the man an 8-pack. The big problem is the excessive three-dimensionality, which does not match the rest of the figure at all, and the unusual shapes. It is quite possible that the doctor cried during this operation. Another example is Kenny O'Neill, who really had oversized shoulders that look like 2 huge horns. They call him the synthol guy, but he might as well have used a pair of implants to achieve this effect. In an interview with Dave Palumbo, however, he emphasized that it is neither implants nor synthol. He claimed it was an infection that occurred just before the competition, in a place where he had used various substances. What really happened and what exactly was in his shoulders is unknown, and everyone has to answer this question for themselves. These cases were obviously extreme at a higher level. You won't find a similar example. But that doesn't mean that there are no implants at Mr. Olympia, because there are, and in large numbers. However, no one seems to complain about them. Although breast size is not one of the judging criteria in the women's categories, some sources claim that the judges want to see beautiful breasts, as can be read on the Elite Fit's website. However, for aesthetic reasons, it is difficult to imagine male bodybuilders at Mr. Olympia having a fake chest or fake arms. The muscle area that is most often in doubt are the calves. Lee Priest is convinced that the legendary Hulk himself, Lou Ferrigno had implants. This relates to his figure when he returned from a long break in 1992. If you look at the comparison photos, it seems as if the size of his calves has doubled compared to the 1970s. On this scale, the development is suspicious in itself, and in addition, they appear to be smoother and more swollen than real muscles. Lou Ferrigno himself, of course, admitted nothing. There are also opinions that it was not implants but oil, but the first version is most widespread. There was definitely something wrong with Dexter Jackson's calves too, as can be seen in the recordings of Mr. Olympia 1999. Sean Ray also accused Flex Wheeler of using implants. What's more, he demanded that the then IFBB CEO Wayne DeMille thoroughly investigate the matter. An MRI examination was carried out and it was found that Wheeler's calves were not implants. He himself later said that they were the result of substances being injected into the calves, which had caused inflammation and swelling. Furthermore, Victor Martinez, Daram Charles, and even Arnold Schwarzenegger himself were accused of having implants like this. Although I personally see no reason for this, as this part of his body looked perfect even without silicone. Apart from the individual cases that I described at the beginning, implants are rather rare in bodybuilding anyway, for the simple reason that, like large amounts of oil, they completely spoil the perception of the figure. When they do appear, it's on the calves, which are very difficult to enlarge for athletes with short calf muscles, especially black athletes. Let us know in the comments if you would prefer synthol or silicone calves. That was Steel Shock. See you in the next video.